All right, thank you for staying with Daybreak. This is State of the Nation. We talk about all matters, politics, and everything in between. We'd like to hear your views on all the issues we're going to talk about. Trevor Mbija, Citizen TV Kenya, hashtag Daybreak. Let me introduce my guest one more time. Dr. Tiende Amolo, Member of Parliament for Arieden, JLAC Vice Chair, is here. Honorable Samson Cherargei, Nandi Senator, is with us. Dr. Kimani Wamatangi, Kiambu Senator and Majority Whip, is here. And Dr. Alfred Mutua, Machakos Governor. The same panel we always have every day because they're the ones who give the voice to the state of the nation. Let's start off with the Daily Nation. The flights to and from India will stop from Saturday. CS for Health says everybody else who comes in will also be subject to a mandatory test and a mandatory 14-day quarantine if they test positive at their own cost. This is happening from this Saturday. And Dr. Tiende, I'll start with you on this issue. Was this the right move, considering a lot of Kenyans depend on medicine from India and even medical procedures from India?
I support this move by the government. As I've said before, I think that once or twice the government took similar measures, especially in respect of flights to Tanzania. But because of political pressure, they relapsed. And it is my conviction that that is largely what contributed to the third wave that is now ravaging us. It is true that in recent times, India has been the hardest hit country in terms of COVID. And in fact, the number of deaths per day has exceeded what we've seen anywhere else. Now, while we sympathize and empathize, but the first duty must be to the Kenyans. And I think that in order to protect the possibility of us having yet another strain and yet another wave, it is important to suspend these flights. It is not out of malice, it is out of reality. Secondly, in terms of drugs and all, the cargo flights have not been banned. So if there was any possibility of any medicine that we need to receive or any exports that we need to take there, it will still be there. In any event, you realize that while in the first phase we had relied on supplies from India for the AstraZeneca vaccine, India itself suspended export because of the domestic need. So I think that it is the right move. I think it is also reasonable that it was not instant. It's about 3 or 4 days notice, so that those who had planned to travel or are already traveling would be able to travel. And I also support the idea of the rapid test and the requirement for the 14 days self-quarantine thereafter. I think that the only thing that would raise issues is this question of those who test positive, then they will be mandatorily quarantined in a public facility, while those in this country who test positive are not mandatorily quarantined anyway. They are just, advised to self-isolate. Yeah. And so that question of difference of treatment for those then would be an issue. But I suppose it's because one does not know. Yeah. It could be a new strain, in which case you need to contain it. Yeah. So I support this move.
Cherargei?
First of all, we continue to sympathize and empathize with India for the losses. I'm told projections yesterday was that of 3,000 deaths, and they're projecting in August that 1 million in India. I think this comes as very important, and I remember last week, it's only I said here that we cannot be saying we have locked down the disease counties, yet the border between Tanzania and Kenya is still open. And Tanzania itself as a country has not used scientific methods to contain the COVID pandemic in that country. And you saw there were reports that there could be a variant that comes from that region, and my brother has alluded to that fact, that the reason we are seeing third wave in Kenya could be that possibility. So I hope as they ban flights from India, they should also be working to ensure that we do not allow the opening of the border between Kenya and Tanzania, because it doesn't make sense that we lock down 5 counties, yet there is still that interaction that is still happening. So I support and I hope the government will be very stringent in terms of those people who are coming back. Yeah. I think the priority is the interest of Kenyans at the best as much as possible. we would also want to see that when they come back, and we want to urge, because we know India is very important for Kenya, especially for people who are seeking medication. For us who normally do Harambes over the weekends, most of our constituents travel to India to get specialized treatment.
Yeah.
This is a wake-up call to the Ministry of Health and also as a country that in future we should try and improve on our medical services and provision of medical care in this country,
Yeah.
so that when hard times hit the country, it is important. I think another factor is that it is worth noting that the cargo flights will continue.
Yeah.
Remember that we depend on most of the imports also from India. And we wish them. I noticed something curious. I don't know, the weeks before that this wave hit India, I noticed they might have been having elections. And I used to watch online, the Indian Prime Minister, Indira Modi, was campaigning largely. So I was wondering whether COVID was still in existence in India until the other day. So we hope now that they have suspended sending vaccines to other countries,
Yeah.
we hope they'll be able to contain. But I'm happy, I've seen, is it Blinken, the other day saying that they will assist Kenyans with more vaccine through COVAX or bilateral agreements, and we hope the vaccinations will continue. My appeal to government,
Yeah.
as I conclude, is that let us allow more importers, and even if it is private, to bring vaccination to the country, so that people who are able, like here, governor and the senators and all of us who are here, if we can go and vaccinate ourselves in private facilities, pay 2,000 shillings, 3,000, so that that vaccine can be taken by a mkokoteni pusher or somebody who does not have that ability, so that we can move very fast in terms of vaccination in the country.
Okay.
I think that is a positive, and we hope. And finally, we should not go back where we were in March, where we delayed in flights. If there is any issue like the UK, if we notice, I want to advise the Ministry of Health that they need to be proactive. They don't need to be, if it is in the interest of, because whenever curfews and lockdowns happen, the president normally tells us we are looking the country for the interest of you. But when it comes to flights coming in and out of the country, it's always a different story.
Okay. Dr. Mutua?
I agree with my colleagues here, and I want to say good morning to the viewers out there, and especially to my brothers and sisters of the Muslim faith. Ramadan still continues in this important holy month. Before I say that, I want to say, pass my condolences to the family of Philip Ochieng, who we worked with when I did some work at the Nation. I remember reading his book about the Kenyatta succession, where he talked about the Ngorokos, how they tried to stop Moi from taking over, closing and everything, and he was a great journalist, and he lived his life to the full, and tutaonana naye baadaye ikiwa ameenda mbinguni, kwa sababu tunaenda mbinguni. Now about India, it is heartbreaking. Yesterday I was watching news and they were saying that a person is dying from COVID in India, one person every 4 minutes. That's a lot of people. That's a lot of death. If you look at the chaos that is happening in hospitals, people are holding oxygen tanks outside because there's lack of space, there's lack of oxygen. There's a woman crying that she had just lost her brother and her father is dying and there's nothing you can do about it, and she's just watching them. And then there's the mass crematorium. You know, people are being, cremated in public, in parking lots, because of the heavy toll. This is a big tragedy that has faced India, and I give them my condolences. But also it's a wake-up call to us as a country. I remember when people were shouting, oh, Uhuru, unlock the country, wacha tuzunguke, let us continue with our life. You know, it's because President Uhuru knew, and the Ministry of Health and us as governors, when we said let's slow down this pandemic, we could foresee this where it's heading. Yeah. India is much more advanced in terms of medical facilities than Kenya. They have had much more, but look at how they have been overwhelmed. In Kenya, we are talking about lack of oxygen and about all those things. So for me, what is happening in India is a wake-up call to us. About the flight bans, I agree with my friend Senator Cherengai that we shouldn't wait, because other countries had already stopped flights coming from India. You know, we had Italy, Germany, Singapore, Australia, France, UK, etc. We are huku number 12, number 13. We also need to be proactive. Let us not wait and copy. Let us also lead the way, because it's about us and it's about protecting our people who are coming here and about protecting our country. So I do agree that the stoppage of flights is essential, and we don't know the strain that is killing our brothers and sisters. But also as a country, we're a poor country. But India has always been there for us. They have supported us with a lot of times. We've heard about Indians giving us scholarships for kids to go there. You don't have to have a lot of money to help. Yeah. And I'm seeing that other countries like the United States, UK are sending support to India. As a country, I think it's about time our government also stood up and said, even though it's not much, hii magunia ya mchele, tupelekee watu wetu India. Or something as a gesture to our Indian brothers and sisters. Yeah. Let us help each other, even though we don't have much, but let us extend that help to our brothers and sisters in India. Okay. We don't have to wait when everybody else has done it, then we do it. Okay. We can also do it.
All right. Omatangi?
Good morning, Trevor.
Morning.
Morning to our viewers too. Trevor, I think as much as my friends have said that indeed it is a wake-up call, I hope it is more of a learning process for us political leaders who have the capacity to mobilize people in large numbers outside. Mm-hmm. It was said that there's a festival that the Indians normally hold, and it was reported in the news that they chose to ignore the calls not to hold that festival, where they go and dip themselves in a river in millions, and they did so, and that's the outcome. That should address this big question as to why have we banned rallies, gatherings, and so on. When I say we, I mean we as a country, not me, not myself, because I don't have the power to. Yeah. But I think that should bring a sense of sobriety. Now, the other thing that comes to my mind, and I appreciate where you started, Trevor, is indeed the level of dependency that we have on the medical facilities in India and their expertise in medicine. Some times back, I must remember that I attended an occasion in Governor Mutua's county, and I'm surprised that he's not talked about it. Mm-hmm. I was very excited when I went to a big occasion where Governor Mutua promised us a lot of things, and he had brought in a lot of investors from all over the world. And one of the things that he promised was that he's bringing India to Machakos, and he had set aside a big portion of land where he said he was inviting people to build medical facilities and host doctors in that area. And if there's anything I remember about that day, Mutua, is what he had promised. I thought it was going to be a very good thing for this country. What I'm saying is this, Trevor, that if you look at relationships between either countries, communities, whereby you're dependent on another for a certain service over the long period, what usually happens is you try to create some semblance of a better working relationship. And what I would have been thinking, once we have seen how much Kenyans depend on India for especially cancer treatment and so on, we should, as of now, we should have had an arrangement. For example, should we have thought, yes, these are our people. Though they are going privately, they are Kenyans. It is out of need and problems. Yeah. That's why they're going. So what should we have done as a country to make this better if, as of now, we cannot bring those facilities and the costs in India here? Maybe we should have promoted, like we've said here before, telemedicine. A better and more efficient way of making sure that if it is diagnosis, it is done quickly, and you have ways of not getting people to travel to India. There can be conferencing and an exchange of diagnoses and drugs sent here. Yeah. I mean, we should have thought of how would we make it easier. I want to say, Trevor, as of today, indeed I have a friend of mine and his wife who traveled a few days ago to India after his wife was diagnosed with cancer. We raised funds, and they were to go there for a while. If that is one friend and another that I know, there are thousands of Kenyans right now who are there, who are going to be affected by this ban. Yeah. I think we need to rethink our approach. And I appreciate the fact that the government has had to balance between two extremes. Yeah. I mean, having to protect our people and institute and have this ban ongoing. Yeah. I think that wake-up call should be very loud in our minds, and especially those in leadership, especially the health sector, so that we ensure that we get long-term solutions to this problem.
Right.
I think let me finalize by saying that for areas in Kenya whereby we know that they are densely populated, like in Nairobi, where we have informal sectors, we need to learn from this and know that, for example, the reason why you're seeing numbers so high in India is you compare it with the population of India, which is more than 1 billion plus. And so when you ask yourself, what would happen if this pandemic was uncontrolled in Kibra? If it was uncontrolled in Mukuru and Mathare and other places, and in Thika, Kiandutu, and in Kisumu, or Bunga, slums, what would happen to those people? And I think this is where we need to be rethinking about what should we do as a nation to make sure that we put an end to this. I said that, Trevor, because you don't know whether there's a fourth wave. We dealt with the first one. Nobody thought that there was going to be something called a second wave. We've had a third one. Who knows whether they're going to go up to 10? And maybe the mutation of this virus. How severe would it get? I think that we have to start addressing ourselves in a forward-looking way.
Okay.